We are going to talk about addiction and recovery. So, to start with, hi, I'm Cosette, and I'm an alcoholic. Um, so, when I was drinking, I went to a bunch of different resources to try and get help. Some of them worked really well for other people, not so well for me, and vice versa. So, I'm just going to talk a little bit about if you're ready to recover, what steps you can take. Because, of course, the first step is to admit you have a problem and decide you want to change it? So you've already done that step in theory, right? So now the question is how? Now, you already know I am a huge, huge fan of the online therapy services called BetterHelp and Lyra. They're very similar. You get an online therapist, you have resources, you've got worksheets, you've got webinars that you can attend, and you've got your person you can talk to, that you can text in a tight bind, that you can make regular appointments with. So that, and if the first one doesn't fit your needs, they are not offended if you need to switch. There are therapists that specifically specialize in addiction recovery, right? So, first two is definitely therapy, BetterHelp and Lyra. BetterHelp has, or had, back when I was using it, they had a financial aid program. So, if you need to look into that, definitely do it. If you don't have insurance and things like that. I also had gone to the Women's VOA Detox Center, one of the early days of me attempting to recover. And you can stay there for up to 2 weeks. There was all sorts of different classes and stuff to help you find hobbies and things to replace the addiction with. And I mean, there were girls in there that were on tar. There were girls on there recovering from ice. There was, or I guess I shouldn't say, crystal. I don't know. I'm sorry. I don't know what I can say on YouTube when it comes to those substances. But it wasn't just alcohol. It was like a ton of it. There was a lot of women there recovering, and we were all working together. We were all building skills together, going to these classes together, and it was a really great experience. So, the VOA Detox Center, I definitely love, and it was actually from one of the other women there that I learned about BetterHelp. Of course, there's always online support groups. You can pop onto Facebook and find a support group for almost anything. Be careful with those because you can run into a lot of really nasty, really judgmental people online. I am also a recovering judgmental person. I'm very judgmental. I can be very, very judgmental. But so you kind of want to be a little more careful with the online support groups. And of course, there's the old school. If you are more into the like hit the ground running, do it in person, there's always the AA and NA meetings. There are websites you can look up where they're at. You can walk into just about any rec center and just ask the front desk if they host one or if they know who hosts one, and they might be able to help with that. The biggest thing that you need to keep in mind when you're going into recovery in the very early days is you have to advocate for yourself. A lot of programs, it's a detox and turnout, right? And they'll tell you you're depressed because of the substance, you're anxious because of the substance. But a good amount of the time, at least, in my experience, for me, I used the substance because of my issues. I was trying to self medicate, which is never the right answer, right? So you really have to advocate for yourself. You have to be like, no, we also need to treat this. You can't just detox me and expect it to go away. We need to treat this. Sometimes you'll have to advocate for yourself. Sometimes you have to speak up and be like, I cannot leave until you get me a referral to a therapist. Now, if you go into the ER to try and get recovery resources, there's a chance you have to really put your foot down and be like, no, I cannot go unless you help me for real. So, they really like to, because alcohol and drugs can exacerbate mental illness. or lead to mental illness. And the lead to mental illness is where they put a lot of their focus on. But what it would really help with people is, what is causing the substance dependency. Now, you can't just get it out of their system and expect the whole world to change around them. And yeah, yeah, that's just you need to have the appropriate aftercare. Advocate for yourself. Say, I need to go to therapy. I need to go to the VOA. I need to go to the psych ward. I need to do these things. I need help with these things because getting clean is not a real solution if you're not helping the underlying causes, right? Um, so push for them to give you the resources. Push to get your referrals. Push to be sent to, if you need to go to a detox center, really push for it. See if they're willing to give you a temporary bed until something opens up if you have to. You know, because you don't have to do it alone. You shouldn't have to do it alone, right? And then if the doctors do give you medicine so that it helps curb the cravings, you'll want to do a little bit of research. You'll want to see if the benefits outweigh the risk because there's some medications that are just like I would not recommend. I couldn't tell you off the top of my head what they are. Well, gabapentin can cause seizures. It's supposed to treat seizures, but they also use it to treat alcohol addiction. But if you aren't taking it consistently or taking it on and off, it can make things worse, not better. So, there are medications that you have to be wary of, but a lot of the medications out there to help curb the cravings are super beneficial. They will help. You just have to make sure they're not one of the ones that have beyond adverse side effects or whose withdrawal process is just as harsh, if not worse, than whatever substance you're already on. So, advocate for yourself, do your research, use your resources. I believe in you. I love you. You can do this. All right. Bye bye.